Then we have the middle ear. The middle ear is formed of important structures which are called the ossicles, which are the malleus, the incus, and the stapes. The malleus is important to know that the malleus is formed of a head, okay, and the handle of the malleus. The handle of the malleus is attached by a muscle which goes anteriorly, okay, through a canal called tensor tympani canal, and the muscle is called tensor tympani muscle. Okay, and the other muscle is the stapedius, which lies from posterior from a structure called pyramid. Okay, posterior in the middle ear cavity goes a muscle called stapedius, which attaches to the neck of the stapes. Both stapedius and tensor tympani, the function of them is to reduce the intensity of high-pitched sounds that reach the inner ear. The other thing that you should know in the middle ear cavity that it has two openings: an opening which goes to the mastoid air sinus, and an opening which goes to the nasopharynx. This opening is called the antrum of the mastoid air cell, and this one is called the Eustachian tube. What you should know about them: the relevance of knowing that this antrum opens into the mastoid air cell is that when there is inflammation and infection in the middle ear, this infection might reach this antrum and might reach the mastoid air sinuses, okay, and chronicity of the infection will lead to mastoiditis and necrosis of the bone of this mastoid part of the temporal bone, okay, and so even if you treat the infection here, pus will continue to be present here, so the treatment will be different by mastoidectomy. Anyway, this is not our subject. So we have the middle ear. It has two openings, one opening into the antrum and one into the Eustachian tube. Regarding the Eustachian tube, as we just said here, we have the external outer third is cartilaginous and the inner two-thirds is bony. It's the same here. As we have bone here, so we have bone here and here. Okay, it will not be different. So we have bone here, and bone here surrounding here. Here there is cartilage, and here there is cartilage. In the outermost regions there is cartilage and cartilage. But here in the middle we have the bone. Here we have the bone. Here we have the bone. What is the bone that lies over all those structures? Is the petrous part of the temporal bone. Yes, it's also relevant because as if there is inflammation in the middle ear, the infection might reach the petrous part of the temporal bone, leading to pertussitis. Okay. Then we have the inner ear. The inner ear is called the labyrinth, and it is formed of three main structures: the cochlea, the vestibule, and the semicircular canals. The inner ear has two functions: control the balance of the body, okay, and for sensory neural hearing. The importance of the external determinants in the middle ear is conductive hearing, and the function of this is sensory neural hearing. So when you have a problem in any of these parts, you will have conductive deafness. But if you have a problem here, you will have sensory neural deafness plus problems in balance, which is called vertigo. Another thing about the Eustachian tube: this tube is usually closed, but it opens when you swallow or when you do a Valsalva maneuver. What is the function of this tube? It controls the pressure between the middle ear cavity and the nasopharynx, between the middle ear cavity and the external auditory meatus, so there is normalized pressure, and this is important to prevent otitic barotrauma, and also to drain any secretions that are present. And this Eustachian tube leads to the most pathologies that occur in the middle ear. So if the Eustachian tube is closed or anything like this, there will be accumulation of secretion, and even if there is infection, the pus has no place to go other than bulging into the eardrum and leading to rupture of the eardrum, or going to the mastoid air sinus, leading to mastoiditis and other complications that we are going to talk about later. Now we are going to talk about something important, the tympanic membrane. Tympanic membrane, as we just said, we said that the tympanic membrane is formed of 3 layers. The outermost layer is formed of skin from ectoderm, the middle from mesoderm, which is connective tissue, and the inner from mucosa from the endoderm. When you have an otoscope, okay, inside your patient's ear, you are going to see a picture like this. This is called the tympanic membrane, and as the malus is present here, just lateral to the tympanic membrane, it will lead to a fold on the tympanic membrane, which can be visualized on the otoscopy, on the otoscope, okay, as this fold here. This fold is called anterior malleolar fold, and this fold is posterior malleolar fold, and this divides the tympanic membrane into pars flaccida, which means that it's flaccid, and pars densa, and which is dense and highly attached. So just from the names, if you got a trauma, severe trauma as a blow by the palm of the hand, where it will be the rupture in the tympanic membrane? Definitely in the part which is highly attached, okay, it will be more prone to be traumatized and ruptured. But this one is flaccid. So even if there is indirect pressure, air pressure, or direct pressure, it will stretch, so it will not rupture. But this one is very highly stretched already, so even a minor trauma relatively to the flaccid will lead to its rupture. So we have pars densa and pars flaccida. But pathology as otitis media, discharging pus, it might rupture from the pars flaccida or pars densa. And on otoscopy, when you have your light on the ear, inside the ear, you will have a cone of light. And this cone of light will be absent when you have otitis media. A brief review of what we just have talking about. This is the middle ear cavity, this is the external determinatus, the extension of it, and this is the tympanic membrane. This is the malus, this is the incus, and this is the stapes, and this is the side of the inner ear. We talked about that posteriorly in the middle ear cavity we have something called the pyramid, in which a muscle called stapedius goes to attach to the neck of the stapes. And we have here the malus, and the handle of the malus is attached to the muscle called tensor tympani muscle. So we talked that the function of those muscles is to control the intensity of sound, of high-pitched sounds which reach the ear, especially the inner ear. The other thing that you should know that the stapedius is supplied by the facial nerve, and the tensor tympani muscle is supplied by the nerve to medial pterygoid, which is a branch from the mandibular. Now we are going to talk about the relations of the middle ear cavity. This is a picture of the middle ear cavity. This is the middle ear cavity. So your patient is looking forward, okay, he is looking in this direction, okay, his eyes are looking in this direction to the right, okay, and his ear is here. So he is looking to the right, and you are looking just for his ear in front of you, and he is looking to the right. So this is anterior, and this is posterior, and this is lateral, and this is medial. Okay, so this is medial, and this is lateral, and this is inferior and superior. Now we are going to talk about the structures which lie anatomically anterior, posterior, etc. to the middle ear cavity.